Welcome, everyone. My name is Rachel Massey, and I'm the Senior Science and Policy Advisor with CHE, the Collaborative for Health and Environment. Today's webinar is the second in a three-part series exploring chemicals in building products, disproportionate exposures, options for choosing healthier building materials, and implications for children's health. This series is co-hosted by the Collaborative for Health and Environment, Blue-Green Alliance, the Program for Reproductive Health and the Environment at UCSF, and Healthy Building Network, in partnership with Green Building Alliance, the Center for Environmental Health, and the Children's Environmental Health Network. We had a great set of presentations last week, and if you missed that first webinar, you can review both the recording and the associated studies on our website. We'll put that link into the chat in case that's useful. Today, again, we have a really excellent group of speakers, so I'm really glad that you can join us all. We have a few bits of housekeeping before we get started. If you're joining by phone, you can download the slides from the webinar page on our website at healthandenvironment.org. And for those who are online, we'll put that link in the chat now. Please feel free to put a note in the chat introducing yourself and where you're joining us from if you'd like to. We will also be putting links into the chat during the presentations for those of you who'd like to see the specific studies that the speakers are referring to. And we look forward to your comments and questions. Please type your questions in the Q&A box at any point, and we'll get to as many as we can after the presentations. If you would like to activate closed captions, you can do that by clicking the button on the bottom of your screen. This webinar is scheduled to last for an hour and a quarter and is being recorded. Now I'm pleased to introduce our moderator. Simone Early is the Assistant Director of the Architecture, Engineering, and Sustainability Unit in the Massachusetts Bureau of Housing Development and Construction. Simone oversees a team of architects, engineers, and the sustainability developer who provide design oversight on the capital projects at 233 local housing authorities across the Commonwealth of Massachusetts. Her work includes providing design guidance for effective strategies for resilience to climate hazards, designing for healthy building environments, increasing energy efficiency and reducing greenhouse gases, employing methods for aging in place, providing durable and safe housing, and developing creative community space. Simone is deeply invested in advancing environmental justice and equity for families and elderly with limited incomes. Simone, we so appreciate your leadership in this area, and we're really happy you could join us today. I'd like to invite you now to set the stage for this conversation. Simone?
Sure, great. Thank you, Rachel. That was really nice. As Rachel said, my name is Simone Early, and I really want to thank you for taking the time to join us today for this discussion on healthy building environments. We're super excited to engage with you on this topic, which will explore how healthy building products can help to protect the health of vulnerable communities. For my day job, as Robin said, I'm an architect, and I direct a team of architects and engineers and the sustainability developer at the Department of Housing and Community Development in Massachusetts, also called DHCD. My team does capital projects at the 233 state bond-funded local housing authorities that Rachel mentioned, with approximately 45,000 units of public housing, and that's primarily for elderly and families, but also a few others. Because many of our residents are at the highest risk for health issues and also have the least amount of control over their environment, the need for DHCD to minimize environmental and health impacts in public housing, to develop a process for addressing healthy building environments, and to implement design strategies is crucial. And not the least of needs is also to allow for a setting for residents to advocate for themselves in an effort towards environmental justice. To do this work, we have included healthy building environments in our sustainability program, which additionally addresses the traditional issues of sustainability, of resiliency, energy, and greenhouse gas conservation. And we have started developing design guidelines for our projects with the assistance of groups such as the Healthy Building Network presenting today, luckily. I think there's a link in the chat for their guidance to us as well. Ultimately, what we all know is that building a healthier environment is a shared effort, and that the work is about caring for people. So to progress, we need to develop a higher level of consciousness around healthy building environments, and this is harder to create than one would expect. We really have to have a change in consciousness, a change in commitment, a new sense of urgency, as well as an appreciation for the privilege that we all have that allows us to take on this challenge. And we have to somehow translate this impetus to our design teams, our staff, our stakeholders, that we are being presented with a choice to be part of a collective environmental action. I think today's presentations will inspire you, so I'm excited to get going on those. And with us today, in order of presentation, we have Dr. Robin Dodson, an Associate Director of Research Operations and a research scientist from Silent Spring. Silent Spring is a scientific research organization dedicated to uncovering the environmental causes of breast cancer and whose research is empowering a revolution in environmental health to prevent cancers by reducing people's exposure to harmful chemicals. Next will be Dr. Roberto Valle-Kinlock, who manages the Home Free program at the Healthy Building Network, which I have used before. And he equips affordable housing practitioners like ours with material health knowledge and tools for safer building product decisions. And lastly, Dr. Veena Singla, a senior scientist with the Natural Resources Defense Council, an organization which works to safeguard the earth, its people, its plants, its animals, and the natural systems on which all life depends. So let's get started with their presentations, and hopefully everyone will come away with information and some tools to use with developing their goals for your own healthy building environments. And don't forget to put questions in the Q&A. Okay, I think that means you're up, Robin.
Wonderful. Go ahead and share my screen. Just confirming you see the presentation. All right, so I'm going to go ahead and get started. I'm very excited to share some of our research today from Silent Spring Institute on chemical exposures in the home. In particular, how we are trying to identify sources of exposure to inform interventions. So I feel like I have to start with the kind of the obligatory why the indoor environment matters, right? We know that we spend more than 90% of our time indoors, and some vulnerable groups, including very small children and older adults, spend even more time in the home, and that indoor air concentrations are often 2 to maybe even 100 times higher than ambient concentrations. And this is because of our proximity with sources, because of the density of sources, and because we do a really good job of designing homes to protect the indoor space, which also means that chemical degradation is slowed or delayed in the indoor environment. When we think about the indoor environment, right, we maybe think about traditional indoor pollutants, particulate matter, carbon monoxide, lead, radon, VOCs. But I contend that there's actually hundreds, if not thousands, of additional chemicals that we should be thinking about as well. These include things like phthalates found in vinyl and paints, parabens from personal care products and other surfaces in the homes, antimicrobials, bisphenols, ethanol amines, which are found in cleaning products, even fragrance chemicals in our everyday products, UV filters added both to our personal care products, but as well to our paints and other surfaces in the homes, flame retardants added to upholstered furniture, electronics and installations in our homes, and of course, PFAS, or the per and polyfluoroalkyl substances, commonly found in stain-resistant treatments, water-resistant treatments, and even paints in the indoor environment. We know that these chemicals, though, do not stay put. They do not stay in the materials in which we bring them into our home. Rather, they migrate out of these materials and unfortunately find their ways into our bodies. So what I'm showing here are actually the monobenzyl phthalate concentrations. That's a metabolite of BBP, or butyl-benzyl phthalate, which is found in vinyl floor, amongst other materials in the indoor space, from CDC's National Biomonitoring Program, known as NHANES. And I'm showing here concentrations, mean concentrations for children aged 6 to 12 years. And what I want to point out, which I think is pretty pretty common across many of these chemicals, certainly amongst the phthalates, is that not everyone is exposed equally. In fact, we look at non-Hispanic Black children tend to have much higher levels of phthalates in their bodies compared to other children. So the question is why, and what can we do about it? I really like this framework that Gary Demkowitz and others have put forward several years ago now in an AJPH article, in which they are trying to move environmental justice indoors. The idea is that environmental justice is not just a kind of an outdoor pollution problem or issue. Rather, it is something that we need to contend with and tackle in the indoor environment. And we need to think about this across multiple levels. They include things like sources. What are we building our homes with? What kind of pollution is able to infiltrate into the indoor space? But also, what are the conditions of the home and what are the behaviors in the home that could have an influence or impact somehow the concentrations or the exposures that people are experiencing in their homes? Now, many of the chemicals that I researched are known as semi-volatile organic compounds, or SVOCs. And what makes these tricky is that they readily partition between surfaces, indoor air, and house dust throughout the home. So what that means is that our intervention strategies have to be more holistic, and we have to incorporate what we know about the physical and chemical properties of these chemicals in designing effective interventions, because they can just readily partition to other places. This is not just simply a gas out the building material, gas off the building material before you put it into the home, because we know once they get into the home, they kind of move all around and are tricky to kind of capture. So they are moving throughout the home, but this could also inform how we actually might go ahead and measure some of these chemicals in the indoor space. I'm relying on indoor exposure studies that Silent Spring has conducted over the last 2 decades that started actually with our Cape Cod household exposure study way back in 2000. In this study, we were the first to measure many of these EDCs, these endocrine disrupting chemicals, phthalates, some of the parabens in indoor spaces. And this is our home-based study looking at 120 households on Cape Cod, that's sticking out there in Massachusetts. And we looked at indoor air, house dust, and urine. We extended this work into California, looking at Richmond and Bolinas. We've done additional work in low-income housing or subsidized housing units in the Boston area. We've also been on college campuses, looking at flame retardants and other persistent chemicals, and also in subsidized housing in Boston, Cincinnati, and New Orleans, amongst other places. And so a lot of what I'm talking about today is based on the fact that I've taken hundreds of samples, either in air or dust, across the country to try to characterize exposures. And what do we see? Well, this is actually a meta-analysis that we were part of that actually Dr. Woodruff brought up last week that was looking at common SVOCs, or consumer product chemicals, in household dust. And we looked across the literature, including many Silent Spring studies, but across the literature at phthalates, the phenols, flame retardants, fragrances, and those PFAS chemicals. And we saw that across the studies that we looked at, that every single home has phthalates. In fact, every single home I've ever sampled in has phthalates in them. These chemicals are highly ubiquitous. We also are quite ubiquitous are the fragrance chemicals. Flame retardants were found in most homes, and even some of the phenols like methylparaben. What I think is interesting here, I'm showing are the chemicals along the bottom and the estimated geometric mean with a confidence interval around that mean. So this is just the mean estimate. This isn't the full range. But what I want to highlight here is the range over which we are seeing these concentrations. And it's really important. It's interesting how widely, how variable some of these levels are. And I think that helps us to start trying to identify some of the sources and also try to target or prioritize some of the chemicals to intervene. But these chemicals are they're not one chemical at a time in every single home, right? That many of these chemicals are operating as mixtures inside of homes. This is analysis that we did of dust that we collected in classrooms or kind of common spaces in college campuses, looking at flame retardants, so those BDEs, flame retardants, as well as some PCBs, some chlorinated pesticides along the bottom there, including DDT, and some PFAS chemicals. One thing I will note is that we actually found DDT banned 40 years ago in these classrooms still, in the majority of the classrooms, which is something to consider in terms of thinking about the persistence of many of these chemicals. And when we looked at these mixtures, and that's what I'm showing on the left here, in particular, if we look at a mixture, which is called principal component 2 over here, we can see that actually that was associated with the wall-to-wall carpet. What that means is that wall-to-wall carpet was associated with a mixture of PFAS chemicals with higher PFAS concentrations associated with wall-to-wall carpet compared to rooms that did not have wall-to-wall carpet. Again, this is starting to help us understand those sources so we can start identifying some interventions. So, right, these chemicals, many of these chemicals, since they are semi-volatile, we can also measure them in air. So while house dust is extremely important when thinking about particularly younger folks, indoor air is very important as well, as an important exposure pathway. Here I'm actually showing some air concentrations for in subsidized housing units in Boston, Cincinnati, and New Orleans where children with asthma were living. And the reason I'm showing this is that I wanted to show not only the ubiquitous nature of many of these chemicals, including the phthalates, the parabens, and triclosan and antimicrobial, but I want to highlight the range over which we're seeing these individual chemicals. Again, this is where we can start playing detective and trying to understand why are some of these levels so much higher in some of these units compared to others. And what can that tell us about the sources, and what can that tell us about effective interventions? So we designed a study a couple of years ago that we called the move-in study. And this study was designed to help us pull apart or disaggregate those chemicals that we are measuring indoors that are ubiquitous. Which ones are coming from the building materials, and which ones are coming for the building itself, and which ones are coming because of occupancy? So this move-in study is in recently renovated housing units in Boston. And what we did is we actually went in and put up our samplers after renovation, but just prior to occupancy, which was pretty tricky to get in there. And then we revisited those units later, more than a month later, to take additional samples. And we can use those data from the two different time periods to try to start categorizing chemicals. First is those that would be mainly contributed to the indoor space or the building materials, and those that might be attributable to the occupant. Now, this is kind of a complex problem. It's not as simple as just it was there before, it wasn't there before. Rather, just as Gary Demkowitz and others had put forward in their commentary, there are a lot of factors or multiple factors that need to be accounted for when thinking about indoor air concentrations, right? Things like air exchange, temperature, conditions of the building. What's the flooring? What's the paint? What adhesives are being used? Are the windows open? Is the heat on? Occupants, what kind of personal care products are they using? What are their cleaning behaviors? What furniture did they bring into the space? And so we incorporated all of these factors when considering our analysis, and we're able to categorize chemicals as related to occupancy first. So these are chemicals that went up with occupancy. So what I'm showing here are pre and post occupancy. So these are chemical concentrations for the various chemicals. We looked at about 100, including many SVOCs or semi-volatile organic compounds, and VOCs. So these would be primarily found in the air. So a couple of things to note, right? First of all, we had chemicals that we only detected post-occupancy, which are clearly brought in by the resident. And that includes things like the BDEs, 28, 100, and 99. Those congeners are associated with a penta-BDE mixture that was commonly used in upholstered furniture until about 2006. We can also see that fragrance chemicals, these are two, AHTN and HHCB, are synthetic fragrance chemicals, increase with occupancy. Triclosan increased with occupancy. BDE 47, that's the other congener in the pentamix. Now we can look at chemicals that we said were influenced by the building itself. So these are chemicals where the concentrations either stayed the same or went down over time. So a couple of things to note, things like toluene and xylene were likely used in the building materials in the renovated units. BP, this is a benzophenone. We typically think of this UV filter as being associated with personal care products, but in fact, we think it's being used in surface coatings as to protect the paint. Here are two chlorinated organophosphate flame retardants that also kind of went down. We think that some of these, particularly the TCIPP on the left there, is associated with insulation. So why does this matter? I think it's important because I think categorizing these chemicals in this way is going to help us to design interventions, whether it be with the building, in the building renovation itself, so in the material specification, working with contractors, or is it with occupant education? So quickly, I just want to share two examples of some intervention work that we've done in the last couple of years, where we've been able to kind of target, based on what we know about the levels and the sources in homes, what has been effective in trying to reduce the exposures or the levels inside the home. The first is a study that we call the couch swap study, and this is a study in which residents in California replaced what we hypothesized to be the largest source of flame retardants in the indoor space, is their couch. So they either replaced the entire couch or replaced the foam that was treated with flame retardants in their couch. And over time, before and then when they switched their couch out, 6 months later, we can see significant declines, again, in that BDE 47, that's a legacy flame retardant, that we can see phasing out over time, as well as some of these organophosphate flame retardants went down significantly. And this is great. This is really good news. We can show that we have identified and targeted a significant source of these chemicals in the indoor space, and by swapping out furniture, able to reduce the exposures and dust. Another one is actually the installation of these Corsi-Rosenthal boxes in classroom spaces, right? A lot of Corsi-Rosenthal boxes are these kind of DIY, very popular air filters that were installed in classroom spaces and other common spaces to mitigate COVID airborne transmission. And so we wanted to know if there was a co-benefit to reducing exposures to things like, or levels of things like PFAS or phthalates. And in fact, saw significant reductions in several phthalates and several PFAS chemicals with the installation of these boxes. We're continuing our work trying to understand the influence or kind of effective interventions for reducing our exposures. This is actually looking at a study that is ongoing right now, so I don't have results to share, but wanted to kind of preview that hopefully I can share in an upcoming webinar down the road. But looking at the influence of lead hazard control, or a housing rehabilitation program in Rochester, New York, and how we know it works for lead, but maybe there's a co-benefit that it actually also works for other SVOCs, including phthalates, pesticides, and flame retardants in homes over time. So I want to leave you with, what can you do to limit your exposures? I think that this happens at multiple levels. I think anywhere from consumers, institutions, retailers, and manufacturers, all the way to regulations. Consumers can make individual choices, join consumer campaigns, highlighting, actually I'll share in a moment, Silent Springs Detox Me app, which has tips based on our research on reducing exposures inside the home. Working with institutions like higher ed, that's part of our Healthy Green Campus initiative. That's where those classroom dust samples came from. Working with them, higher ed, on their purchasing specifications. Of course, engaging with retailers and manufacturers. There's many folks on this call that can speak to that, but that is through the use of restricted substances lists, even also acknowledging potentially the market advantage that those manufacturers might have by reducing toxic chemicals in their products. And of course, regulations. That includes, which I'm intimately familiar with, is the flame retardant flammability standards changes that have meant that flame retardant chemicals or concentrations are going down. So it's been really great to share my research. Just want to share and acknowledge some of my collaborators and encourage you to check out our Detox Me and our website to learn more.
Thank you very much, Robin, and thank you everybody else for being here today. Let me share quickly. All right, it should be good. Again, thank you very much for that great presentation, and I'm really excited to be sharing the panel with amazing set of leaders who are pushing the boundaries of science for both deepening our understanding of the toxics products and the impact on human health, but also developing tools to help us move away to a safer environment. I'll start by sharing a little bit of why we believe this is crucial, that we address material health. Thanks, Robin. I think that you covered a lot of the background, so I'm just going to be, I'm going to streamline it. I will introduce HBN's Informed, a material modeling assessment method that decision makers can use to avoid the worst-in-class building products. And then finally, I will provide some examples of how you can use Inform in different settings, and namely at the project, portfolio, and policy levels. For those of you who are not familiar with Healthy Building Network, we are a nonprofit organization with over 20 years of experience conducting research into building materials and working with practitioners on the ground to develop tools that allow project teams to make safer product decisions. We believe that everybody has a right to know what's in the building products that they use, and that by demanding product transparency and safer product alternatives, we can together transform the market to safer products. We focus on toxics in building products because of the sheer volume that they represent. The unfortunate reality is that many of the products that we use today, commonly used, contain toxic substances. So while we're making important progress in many frontiers towards the delivery of sustainable, resilient environment in buildings, whether either through technological advances in energy efficiency and water conservation, carbon emissions, I feel that there is a topic that is less discussed, and that is of the toxic products that we're using and the impact on human health. Now, beyond impacting the health of the people who occupy buildings, which Robin did such a beautiful job at describing, we also know that toxic products and the toxic chemicals used in them impact the workers that are involved or come across these products across the project life cycle, from the manufacturing of the product, well, actually from the extraction and the refining to the manufacturing, to the workers who work in the installation of these products, of course, the use phase, and those who are involved in the recycling or disposal of these products. Now, we also know that children are being pre-polluted because of some hazardous chemicals transferred from the mothers to the babies in the womb. And all the way through adolescence, children are more vulnerable to toxic chemicals because of their developing bodies and their brains. So I think, and again, Robin was touching based on this at the beginning, so it's at the end of the presentation, so it's a really great segue, because today we have a range of tools on frameworks at our disposal that can help us support safer product use, and primarily focusing on increased product transparency and hazard avoidance. Now, health product declarations, HPDs, are a powerful transparency tool that manufacturers can use to disclose the content in the products and the associated hazards. Declare is a proprietary label by the International Living Feature Institute, which serves a similar purpose to HPDs, and also includes information about whether products being disclosed contain what they're calling what we call the red list substances. And this red lists, together with many restricted substance lists in the market, are databases of chemicals or group of chemicals that are known to have a significant impact on human health. We also have eco labels or third-party product certifications that guarantee that a product meets a given performance standard, such as, for example, GS11 or the EPA Safer Choice, which I happily use, and I'm really happy when I'm looking for household products. Now, product transparency is essential, and this is not just for consumers to know what's in the products that we use and in the environments where we live, work, and play, but for a building owner who is looking to create a safer environment or who may be liable for remediating hazards in the future. Even for product manufacturers who need to understand what's in the products being supplied to them so that they are able to, well, understand what the problem is and be able to improve their formulations. I think ultimately, innovation thrives on transparency. So I think that if we're moving towards a circular economy, the effective and the responsible reuse and recycle of products and materials requires knowledge about the contents and the potential impacts on human health. Now, I'll finalize by saying that the challenges have been, while together all of these tools and platforms are helping to transform the market, there are still important challenges to overcome. Transparency labels for once they're voluntary. So it is up to a manufacturer to decide what product content to disclose and at what level. Because these are self-reported, they can introduce error and be incomplete. And this is something that HPD, the Health Product Declaration Collaborative, is addressing, for example, through third-party verification program for quality assurance. Relying, for example, on restricted substances list as a method alone can lead to regrettable substitutions. And a regrettable substitution, it happens when a hazardous chemical is replaced when another one that is equally hazardous or more hazardous that is not part of this restricted list. And while we're making progress and should celebrate the growth of product transparency, thanks to the work of these great organizations, the reality is also that today, the vast majority of the building products in the market still remain undisclosed. So that leaves practitioners on the ground, or decision makers in general, with the question of how to make an informed decision when the product that you want is not yet disclosed. And this is perhaps the most important question that's been driving our work at HBN for several years now. So building upon over 2 decades of in-depth research into the contents and the hazards of different types of products, we created Informed, HBN's preemptive modeling tool that reveals material health rankings. And again, it's free and accessible to all. We've distilled the research into tidy, approachable guidance that informs user at the broad product level. So when I'm talking about broad product level, think flooring, linoleum, wood, PVC, resilient flooring, carpets, vinyl. And we use an intuitive color ranking system from red to green to help users easily identify what to avoid and what to prefer. We account for a product's health impact during the manufacturing, installation, occupancy, and the end of life. So even when a product is deemed to be safe for building occupants, it might still rank orange or red in our ranking system because it may have a significant impact at any other stage in the life cycle of the product. Now, here I want to acknowledge that there may be situations that don't allow for the use of the product from a best product from a health hazard perspective, which is why our guidance is designed in a way to allow for a step-up approach. We also acknowledge that there are other important considerations when choosing materials. We hear this from project teams all the time, whether it is availability, the cost, performance, carbon. But we also know that a world that is devoid of red products is fundamentally different from the world that we live in today. So material health needs to be part of decision-making. Now, what I'd like to do is to share with you some examples of how you can use Informed, whether to advance material health goals, if you're responsible for designing a building or a renovation or managing a building portfolio, and even how you can leverage this tool or a framework at the policy level. So first, I'd like to state that our guidance is agnostic to building typology. While I work and represent Home Free, which works helping the affordable housing lead the path. This means that our project teams can use Inform to select for safer products in projects ranging from residential, commercial, education, culture, even public spaces. Second, our product guidance can be used at any stage of the design process of buildings. That said, we strongly encourage project teams to use this guidance very early in the design phase of buildings, at the pre-design or conceptual design stage. It is at this phase when the opportunities for engaging, educating, aligning stakeholder requirements and priorities are most significant. That said, Inform is also valuable at the construction administration phase. When value engineering takes place and your contractor may suggest changes in your product selections. So you can use Inform, you can use our guidance to rank the suggested product and visualize how it compares against your preferred choices. Further, we give you the information that you need to discuss and defend your product choices. So just to give you a couple of examples of projects that we've collaborated with. First, we have the Magnolias. Is a 66-unit affordable modular housing development located in San Francisco. This is developed by First Community Housing and designed by Sarah Architects. So we engaged with Sarah early in the design process. The project team convened the owners, the architects, even the modular factory, because it's a modular construction project, and emphasized the material health goals of the project, but also the importance of adopting a product type approach when supporting the safer product selection. For flooring, the project went with linoleum. For insulation, they chose unfaced fiberglass insulation. And for paints, they chose low VOC APE free paint. I would like to call out and shine light on First Community Housing that for several years now, understanding the negative impact, the hazards associated with vinyl, they have committed to not using vinyl in their affordable housing projects and use linoleum instead. And when you compare these selections to other commonly used products in the market, for example, carpet tiles with PVC backing, spray foam, and paint that is, well, it's good enough that it's already VOC free paint, you can start looking or getting a sense of the impact that these product choices have on a single project or a portfolio. Avoiding several hundreds of pounds of PVC or avoiding isocyanates can be asthmagens or halogenated flame retardants that can become carcinogenics, and also avoiding hundreds of pounds of endocrine disruptors. For the second example, we also have a mixed-use commercial building, large, over 600,000 square feet, built in multiple phases. Actually, it's under construction. And in contrast to the previous case study, we engaged with the project team when they were developing the construction permit set. But by engaging with Inform, the project team learned about the hazards associated with carpets, but also about the potential to avoid a significant amount of plastic just by reducing the amount of carpet in the building. Also, in their lactating rooms, they have designed or specified vinyl wall coverings and also tire-chrome rubber, which was being mentioned or supported by the supplier, just touting the importance of it having recycled content. However, much research has been done on chrome rubber, showing that it can introduce phthalates, heavy metals, and other additives that are carcinogens, mutagens, and other reproductive and developmental toxicants. So by using our guidance, they can potentially avoid several thousands of pounds of PVC and some of these chemicals. So these are two different projects, two different sizes, and even engagement at different stages, with benefits ranging from safer product selection and an educated team. And I argue that both have resulted in teams that are better equipped to make product decisions that are safer for all. From a portfolio level, I think at the organizational level, we want to highlight solutions that can impact the material health performance of your building portfolio, whether you're a nonprofit, private organization, or a public agency. And one way to achieve this using Inform is to ensure that your design guidelines are aligned with the guiding principles and product type recommendations that it provides. So I'd like to point to an ongoing collaboration with the Department of Housing and Community Development, represented by Simone, who is our moderator today, where we reviewed building products typically used by DHCD and other local housing authorities in Massachusetts. And first, we mapped a selection of the products using a red to green ranking system. And that alone provided insight into the associated hazards and provided a path to choosing safer alternatives. But what I want to focus today is what you can do with the resulting data. First and foremost, you can create a baseline. We can talk about percentage of products that are ranked yellow and above, percentage of products that are orange and below, and even percentage of products that have multiple rankings. Now, when you take this information and you distill it at the level, for example, of the project level, then you have information that allows you to do goal setting and set benchmarks for your future projects. But at the product level, it's also very interesting because now you can start visualizing the different product categories and a clear visual of the performance of your products from a health hazard perspective. And once you start visualizing your product choices in this form, it becomes easier to prioritize product groups based on the overall performance. And finally, when you take a step back and you look at what you have now, it's a framework, it's a strategic framework that you can use with a clear baseline, goals, and a roadmap for achieving your goals. Finally, now that we have discussed ways to simplify hazard avoidance and safer product selection, we can talk about ways to amplify and scale the use of safer alternatives. Now, in this regard, I believe that further alignment between funding requirements from either public and private sources and city-state level ambitions is necessary. And that in itself comes with a great host of challenges, and one of them being just the lack of a consistent, easy-to-follow framework and accompanying documentation that you can use to report on and demonstrate compliance with material health goals. In this context, I would like to point to the role of green building certifications as a lever that cities and states can and are using to improve the health and safety of the places that we live in. Enterprise Green Communities, for example, is the first and only green building certification exclusively designed for affordable housing. And it's integrated into the funding process for affordable housing projects in 28 states and dozens of cities. Now the number may be greater since the last time I checked. So if you're in the audience, please provide an update. But instead of focusing on the materials criteria, which can be complex for project teams to meet, and also complex for the staff or the teams at the green building certifications to track, I want to draw your attention to the integrative design credits. These are mandatory, these are present across several leading building certifications, and they encourage project teams to sit down, to identify collective priorities, as well as to plan and document how they will meet the building's ambitions. So we believe here is a key opportunity to use a common, consistent framework, such as the one provided by Inform, to educate project teams, to create a baseline of the products that you intend to use, discuss the hazards associated with them, with your early product choices, and then document how you plan to shift to safer alternatives. I think this makes the work easier for project teams as well as certification bodies to track progress, changes, challenges, and use this information to address, together with policymakers, the root causes that are hindering the ability of project teams to shift away from the worst-in-class building products. If there's anything to leave for today, keep material health central to sustainability discussions, not put it on the side. The link between even carbon discussions and material health is much closer than what we sometimes communicate. So consider the impacts across the life cycle of the product and think about the communities and the people that are being impacted at different life stages. Think materials modeling, think early in the design process, and empower users with the knowledge and the tools to make informed decisions. Please engage. Happy to keep talking, and we'll move to the discussion, and I'll pass on to Vina. Thank you.
Thank you so much, Roberto, for that amazing presentation, and thank you to the organizers for putting together this important series of webinars. I'm honored to be in such good company with the other speakers and many of you on this call. I'm just going to share my slides here. Okay, so the work I'm going to be talking about today is funded by the JPB Foundation through Energy Efficiency for All, a national initiative that NRDC is part of. And we collaborated closely with the Healthy Building Network for this work. Rebecca Stam, who presented on the previous webinar, did the analysis that I'm going to be presenting today. So I wanted to recognize her and her work. And Roberto kind of ended with thinking about impacts along the life cycle. And I'm going to talk a lot more about that in my presentation. So I'll tell you just a little bit about NRDC and give some background on this project and why we decided to do this work and the approach that we used, and then present a few highlights of our findings from our case studies. The Natural Resources Defense Council is an international environmental nonprofit that employs scientists like myself and lawyers and policy advocates to advance science-based policies to protect human health and the environment. And we have a staff of about 700 and offices across the US, including San Francisco, where I'm based, as well as in India and China. And we work on a whole range of issues, including climate change and nature and environmental health, which is what I focus on. And I really work to understand the impacts of our systems of materials production, use, and disposal, and aiming to transform them so they are no longer a source of harm to impacted communities and instead support community health and wealth. Some context for the work I'm going to present is our previous work with Energy Efficiency for All, where we wanted to better understand the chemicals of concern in building insulation materials and identify healthier materials for energy efficiency retrofits. So insulation is a key part of an energy efficiency retrofit and contributes to a more comfortable indoor environment by keeping a comfortable temperature, preventing drafts, and helping to seal the building envelope. So we were focused on chemicals of concern in the insulation materials, and we did a deep dive and found that from a health hazard perspective, materials like fiberglass ranked well, while spray foam insulation had the poorest ranking. And you can see again here that kind of green to red chart categorization that Roberto presented. And this research is in our report, a guide to healthier upgrade materials. Now, as Roberto mentioned, building residents aren't the only population that are affected by hazardous chemicals in building materials. Over the life cycle, from that manufacture to use to the end of life, demolition, disposal, these building materials and the chemicals in them can affect workers and communities. And this leads into our current research. So we wanted to understand what these life cycle chemical and environmental justice impacts of building insulation materials are to really have a better quantitative and qualitative picture of those impacts across the life cycle. So we did 2 case studies looking at spray foam and fiberglass. So remember, that was one of the worst ranked materials, spray foam, and best ranked fiberglass in our previous research. And we zeroed in further on a key ingredient for each of these materials. So glass fibers for fiberglass and the isocyanate component, specifically MDI for spray foam. The framework we used for these case studies, so we're again considering impacts over the life cycle. So the diagram on the left there shows the full life cycle of a material, and we focused in on 3 specific pieces of the life cycle: the chemical manufacture, the product manufacture, and the disposal. And then to choose what impacts to evaluate over those life cycle phases, we look to the principles of green chemistry and the principles of environmental justice. And these principles have some overlap, but also some unique areas. So using those principles, we pulled out these 6 major criteria by which we would consider impacts over the life cycle. So the first 4 there: avoiding hazardous chemicals, preventing accidents, pollution, and waste, and implementing circularity and reducing end-of-life impacts, have coverage in both the principles of green chemistry and the principles of environmental justice. The last 2 really come out of the concept of the universal protection from toxics for all peoples, which are part of the principles of environmental justice. And that's the following environmental regulations and preventing disproportionate and cumulative impacts on marginalized communities. So to evaluate the impacts based on those 6 criteria, we did the following main steps. We identified manufacturing facilities for MDI and glass fibers in the US. And then we identified the key chemical inputs that are needed to make those ingredients, that MDI or the glass fiber. Then we searched for publicly available data on those facility emissions and waste. And we also completed a site analysis looking at the demographics of who lived near these facilities, and also whether other polluting facilities were located nearby to consider that potential for cumulative impacts. Here's what we found for the manufacturing facilities. So for the isocyanates, for the MDI, there's the vast majority in the US is produced by 4 major manufacturers, BASF, Covestro, Dow, and Rubicon, each with 1 facility. And all 4 of those facilities are located in the Gulf Coast of the US, 2 in Geismar, Louisiana, and 2 in Texas. For glass fibers, there's also 4 major manufacturers of residential glass fiberglass insulation: Certainty, Johns Manville, Knopf, and Owens Corning. And each manufacturer had multiple facilities. So there was 22 facilities total located across the US. So these facilities and locations are the focus for the remainder of the findings that I'll present. And I'll go through the highlights and compare what we found for the 2 materials. Thinking about the inputs needed to make those key ingredients. So the inputs needed to make MDI and the inputs needed to make glass fibers. What we found is that most of the inputs to MDI production are considered hazardous to human health, over 90%. About half were also highly reactive or flammable. Over 90% were also volatile, which can increase the potential for exposure. And MDI itself is also considered hazardous. It's a respiratory sensitizer and an asthmagen. So for glass fiber production, some of the inputs are hazardous, about 35%, less than 10% are highly reactive, none are volatile, and glass fibers themselves in the form used to make residential fiberglass insulation are not considered hazardous. So while both MDI and glass fibers have some hazardous inputs, overall glass fibers fare much better in terms of that criteria of avoiding hazardous chemicals. Looking at preventing pollution and waste. So here we're considering data from EPA's toxics release inventory for each of those facilities that I showed on the map. And we're only focused in on the chemicals that we found related to MDI production or glass fiber production. So not everything at those facilities. So we found in the top part of the bar graph there, the hazardous releases to air and water. The MDI facilities collectively reported around 560,000 pounds of hazardous releases to the air and water every year. And glass fiber facilities collectively report less than 1% of that much for the glass fibers. In terms of hazardous waste, so the lower part of this bar graph, and this just a note that the scale is in millions of pounds here. The MDI facilities collectively reported over 47 million pounds annually of hazardous waste, while the glass fiber facilities reported about 2.5% of that. So again, while there are hazardous releases and hazardous waste related to both glass fibers and isocyanates, it's much less for glass fibers and on the criteria of preventing pollution and waste. Our findings raise some major concerns for children's health. The releases and hazardous waste that we found included chemicals that are carcinogens, reproductive and developmental toxicants, especially of concern for children's health. We found that a number of the facilities had schools located within a 3-mile radius of the facility. So this map on the left there shows 22 schools within a 3-mile radius of the 2 fiberglass facilities in Kansas City. And we also found that many children lived within 3 miles of a manufacturing facility. So the table here shows the percentage of people under 18 years old living within 3 miles of the 4 MDI manufacturing facilities. And you can see that on average, that percentage of the population is higher than the US as a whole. So these data indicate that children could be exposed to hazardous releases related from these facilities, both where they live and where they go to school. And finally, we looked at some environmental justice considerations. On the abiding by environmental regulations, we found that about half of the MDI facilities had significant violations to environmental regulations for every quarter of the last 3 years, compared to 14% for the glass fiber facilities. Accidents that resulted in worker injuries and community impacts were noted for the MDI facilities, but we did not identify any for the glass fiber facilities. Both MDI and glass fiber facilities are sited in communities that are disproportionately people of color. You can see there the collective percentage of people of color and within 3 miles of those MDI and glass fiber facilities is significantly higher than the percentage in the US overall. And for the cumulative impacts, all of the MDI facilities are sited in places with a heavy burden of other polluting facilities. 18 to 29 additional facilities in each city where the MDI manufacturing is located are reporting to TRI, and all of those facilities collectively together reporting an additional 4 to 15 million pounds of hazardous releases in those communities. The fiberglass facilities were much more variable, with some being sited in locations with other hazardous release facilities and others not. And the additional facilities collectively reported from 1 to 1.2 million pounds of additional releases. So overall, we use publicly available data to assess the chemical and environmental justice impacts of these two building insulation materials as case studies. The framework and criteria we developed could be applied to any material or product if you're interested in better understanding these life cycle impacts. Now, we found that while both materials did have negative impacts on the criteria we considered, glass fibers performed significantly better than spray foam, and there's still room for improvement. We also found limitations in the available data because of a lack of transparency on the chemical and product manufacturing processes. So some of the releases that we attributed to MDI or glass fibers could have been due to manufacturing of other chemicals or materials at those same facilities. So that could be an overestimate. On the other hand, we know, for example, that not all hazardous chemical releases are required to be reported to the toxics release inventory. So we could also be making a significant underestimate. And both the full case studies and a shorter report brief are available on HBN's website. And overall, what our research showed kind of goes back to the beginning of the simple principle that avoiding hazardous chemicals and products protects people over the full product life cycle, whether you're talking about communities impacted at the extraction and production phase in the building or at the end of life. And thank you very much. And I will pass it on to Simone for the next part of the webinar.
Okay. Thank you. That was great. It was really great to hear all of you guys and your presentations. I learned a lot, as I always do. And I think there is an impressive group of people in the audience watching today, so that makes it really exciting, including the person who sort of inspired me to be really interested in this about 10 years ago by telling me about the rabbit hole of toxic chemicals in our systems. So it's pretty exciting to have her here. I am going to jump into the questions that are in the Q&A, and if you have any others, participants, please feel free to drop them in there, and I will also cover some of the ones that are in the chat. So the first question is, and I think this may be for Robin, is there a list rating environmental awareness of housing developers and their use of safe materials? And I guess it could be for any of you. If you know of such a list, I'd like to know about it too.
I'm not aware of a list. I'm looking at Roberto, wondering if there's anything that's been compiled. That's an interesting idea, though.
Mm-hmm. To kind of give people some scorecards.
Mm-hmm.
I would have to go the same, not that I'm aware of, and also pointing at some of the choices that we make or that we've been making are part of the result of how the market availability and how it operates. So there is a lot of factors, and it would have to be a very delicate, interesting, I'm thinking risky approach and balancing, because at the end of the day, you don't want to punish. I think the first step is just being aware and being informed and just being aware of what your choices are. So when you have a project and many of the products that you're using fall in the red, we don't want folks to say, hey, this is, well, it's one awareness about whether something can be shifted, but it's also an understanding that that's part of how the market is behaving, and there's an intention to move forward. So interesting question, not that I'm aware of, and it would have to be implemented in a careful way that it doesn't deter participants.
Sure.
I'll just add onto that really quickly to say, yes, I agree with what Robin and Roberto said, and that generally the information we have, if we have any information, is about a project, not about the aggregated for a specific company or developer. We can sometimes get information on if a project met like a LEED certification or enterprise green communities or something like that. But I agree with what Roberto said, in that the first step is just for companies and developers is an assessment of what they're using and understanding that. And I'll drop a link in the chat to the chemical footprint project. This is an initiative of Clean Production Action, and full disclosure, I'm on the board of Clean Production Action. But I think it's a great initiative where companies can take that first step to just understand their chemical footprint and then start to evaluate how they can reduce it and move to using less hazardous chemicals.
Oh, that sounds great. Yeah, definitely put that link in. I think this one is for Roberto. It's great to hear that Sarah went with linoleum. Do you know how long it's been in place and how it's holding up, and how the costs compared to vinyl?
Such a great question, and it's something that the performance of products is something, and I'll just clarify something about the actual and perceived performance of products. I think it is often perceived that healthier products cost more, often perceived that healthier products underperform other options. And so I think that that's the first step to understand and separate. And sometimes project teams and contractors base their experience of a product based on something that happened several years ago. And there are changes in products, and changing formulations can improve the durability and the performance of products. So to answer directly, while I do not have information about their experience with linoleum in this project, I do know that First Community Housing has been specifying using linoleum in several in projects for years now. So their experience must lead them to understand that it's a fit for purpose, and the benefit of avoiding vinyl and other products it supersedes just the fact of any limitations that a product may have. So, and I'm happy to get them connected. Sarah, I'll get you connected and get more information. I'm happy to connect with First Community Housing as well to learn more about it.
And I'd add that flooring companies have come a long way. Even like traditional ones like Armstrong, et cetera, have come out with a lot of products that are totally cost effective and in line. So it's not limited to just linoleum, which, as we know, can last forever in a house as well. Yeah, in an old house, I think I peeled some up when I moved into my house, so they've probably been there 50 years. Okay, let's see. Which resources would you say provided today will show or have shown the most useful information on what products to avoid, and what are some examples of replacements? I'm going to add to that a piggyback question, which is there an online location, like an online clearinghouse, where all of this information is collected and available to the public? I think in a way it's going to be, which one of these are your favorites? Because there are quite a few. So what do you guys think?
Who wants to go first? I'll say, and obviously there's going to be some bias, but rather than thinking about, I'll take a step back and I'll say, rather than thinking about preferring one over the other, think about it in terms of when is the right time to use what tool. So if you're very early in the design process, I do invite, again, people to engage with informing or product guidance that serves to understand the right lane. It's the example that we use all the time. If you're in the supermarket in the candy lane and you're trying to choose the healthiest candy, because it has more protein or less fat. At the end of the day, it's candy. So what you need to do is get out of the candy lane and go to the vegetable lanes and the fruit lane if you want to get something that is healthier. So start there. And then there are other platforms that can give you more specific information about a specific product. But once you move to the right lane, once you avoid the worst in class building products.
I'm going to ask this last question because we're kind of almost out of time. It it's really, there are two questions, but they sort of relate to each other. And the first one is, are there any law policy proposals to create material guidelines for government construction projects? And then kind of tagged onto that is, are there economic incentives for developers to use better materials at this time that you know about?
So I can take a stab at that. There's, on the government side, there's a initiative that's largely focused on GHG or carbon and sort of low GHG, low carbon related materials for government purchasing. There's a request for information out now on that particular proposal, and I can drop the link into the chat for those that are interested. And I think it's really important to insert into that conversation the importance of considering the full range of impacts across the life cycle, including carbon emissions. So that's one. And then more generally, there are some kind of policy drivers for healthier materials. There needs to be a lot more done in this space. We took a look at this for energy efficiency upgrades in particular, and I'll drop that link in the chat as well, where we found that while there was some movement in this space, that a lot more needed to be done to really have our policies support and advance safer and healthier materials.
Super. All right. I think we're almost out of time. There are unfortunately still some good questions, but I'm going to turn it back over to Rachel. Thank you guys so much for your presentations. They were really informative. Rachel, are you there?
Great. Thank you so much, Simone. And thank you, Robin, Roberto, and Vina, for your really excellent presentations. And thank you so much to all the participants for being so engaged and asking such great questions. A few quick announcements as we wrap up. A video recording will be available on our website soon, and you will all receive an email with a link to that video, and we'll also add into that email, we'll add some of these links that we've been sharing today so you can find them easily. We also invite you to join us next week on Thursday, March 9th at 10 a.m. Pacific, 1 p.m. Eastern for the third and final webinar in this series, which will explore the need for improved federal regulation of chemicals found in building products, as well as the ways in which federal resources can be brought to bear to create safer homes and schools. You'll find the link to register in the upcoming webinar section of Che's webpage, and we'll also put that link into the chat. If this is your first time on a Che webinar, we're really happy you've joined us, and we hope you found this information useful. We also host other collaborative programs focused on promoting environmental health and justice, and you may also be interested to explore our science discussion listservs. You can find that information on our homepage at healthandenvironment.org. With that, I'd like to again thank Simone, Robin, Roberto, and Vina, and thanks to all our partners at Blue Green Alliance, Healthy Building Network, and the Program on Reproductive Health and the Environment, and especially to Jeff Hurley of Blue Green Alliance for all his work to bring this series together, and to Che Director Kristen Schaefer for all of her support for this project. So thanks so much for joining us today, and we hope to see you next week.